Thank you for choosing the Joint Replacement Institute at St. Mary's Regional Medical Center. This is the beginning of your journey to a better life with your new joint. St. Mary's has outlined your joint replacement information in this pre-op education guidebook. It provides you with useful material that will guide you through the entire course of your joint replacement experience. Please read it carefully, fill in the medication section, make plans accordingly, and bring it with you to doctor appointments, surgery, and physical therapy sessions. Surgeries are scheduled on Mondays or Tuesdays to help get patients back home by the weekend. However, your release will be dependent on your doctor's orders and your health. Patients are typically released by Friday afternoon, but in the event of a weekend stay, every effort will be made to afford your requested accommodations, such as a pull-out couch for overnight visitors. The phone number for confirming your surgery date is in your guidebook. This is an important step to be sure nothing has changed. Let your surgeon know if you have any infections or cuts. If you have an infection and don't tell anyone, your surgery will likely be postponed. St. Mary's encourages family and friends to accompany and support you. Everyone does better with a coach, and loved ones are the best suited to assume that role in fostering confidence, support, and improved results. Enlist a coach or coaches to assist you during your week of surgery, drive you home from the hospital, and help you settle in at home after surgery. In addition, you will need to plan ahead for transportation, as you will not be immediately released to drive until after you meet with your doctor 10 to 14 days after surgery. Because total joint replacement is an elective procedure, you must see your medical doctor prior to surgery to ensure you are healthy enough for your procedure. Be sure to exercise your limbs and joints to avoid excess soreness after your surgery. Pre-operation exercises are provided in this DVD set and can be found in your pre-operation material. Please consult your guidebook and make a plan for your recovery. Know your limitations and prepare your environment for convenience during recovery. Eating, bathing, using the restroom, and other common daily activities will have to be considered ahead of time. You will need to have a plan for stairs, remove rugs that slip and slide, and prepare your tub or shower to accommodate you while in recovery. If you have hip surgery, you will have to ensure that your toilet, shower chair, and sitting chairs are at least 18 inches tall, and avoid situations that may cause you to break your hip precautions. Again, consult your guidebook and make appropriate preparations. You may be required to stop some medications as early as 10 days prior to surgery. You will be directed on what medications to continue and stop prior to surgery. Always check with your doctor before stopping any medication. Please write down all of your medication information in your guidebook prior to arriving for surgery and provide that information upon check-in. Pack appropriately for the hospital. Bring any soap, lotion, shampoo, or makeup that makes you feel good. It's important for you to feel comfortable during your brief hospital stay. When selecting your shoes, remember that your feet will swell after surgery. Wear slip-on or loose shoes that have support. No flip-flops or Crocs. If you are having a knee replacement, pack 3 days worth of clothes, including shorts that will not cover or restrict your knee. Select short-sleeve shirts because you will have an IV in your arm. If you are having a hip replacement, bring 3 days worth of clothes, including shorts or pants with an elastic waistband. Again, short sleeves are preferred because you will have an IV. You will also control the thermostat in your room. Please leave your valuables at home. Battery-powered devices are preferred because there are a limited number of outlets. Don't forget your cell phone charger so you can stay in touch with loved ones. You will need a walker for your stay in the hospital and during recovery. Rolling walkers must have 5-inch wheels. You can rent or borrow walkers or buy them new or used. Medicare covers a rolling walker every 7 years. And if you are having hip surgery, you will need to bring a hip kit. Consult your guidebook or ask your joint replacement team for more information on walkers and hip kits. And of course, don't forget to bring your guidebook to the hospital. It is your roadmap to success. By now, you will have prepared your home, designated a coach or coaches, packed, and procured equipment. Review your post-operation plan and consult your guidebook to ensure you are adequately prepared. Do not eat or drink on the day of your surgery, starting at 12 a.m. If you are taking blood pressure, heart, and thyroid medication, do so with as little water as you can. If you are diabetic, do not take your pills or insulin. They will be checked when you get to the hospital. Ensure that you have filled out your medications list in your guidebook and remember to present it to your nurse when checking in. Be sure to introduce your coach to your nurse so they can be kept informed of your progress during surgery. Your surgery will typically take about 1 to 1.5 hours for one knee or one hip replacement. After surgery, you will be moved to recovery, where your doctor will visit with family, friends, and coaches. You will stay in recovery for about 1 to 1.5 hours and then be moved to your room for the remainder of your stay. Plan on 3 post-op days, not including the day of your surgery. When you wake up from surgery, you will be given food and beverage. Be cautious not to eat too much for your first meal. Let your stomach settle. Breakfast is served at 7:30 a.m. and lunch at 11:30 a.m. Breakfast and lunch will be served in the dining room. With the exception of your first meal, you will be walking to the dining room. Dinner will be served in your room. Your vitals will be taken at 5 a.m. every morning to ensure the results are back in time for your doctor to read them. You will work with a physical therapist and occupational therapist during your stay at the hospital and for the duration of your recovery. They will explain how to perform each exercise, how often, and why you should do them. A physical therapist and occupational therapist will visit you on your first post-op day at 8:30 a.m. for a one-on-one evaluation. On the first day, group physical therapy will begin after lunch. Every day after that, the group will meet at 8:30 a.m. and 1 p.m. Participating in group physical therapy during your stay at the Joint Replacement Institute is essential. It offers support, encouragement, and accountability. You will attend a discharge class on Thursday at 8:30 a.m. This class will cover concerns and questions that you and your coach may have. Consult your guidebook for more about discharge planning. Please keep in mind that until 2 years after your surgery, you need to let your doctor know before you have any dental work or outpatient procedures done. Once you have been discharged and you are back at home, you should be wary of potential complications. Blood clots can present as swelling in ankles that will not subside with elevation. Swelling and bruising is normal in either leg. Elevate your leg frequently to prevent blood clots. Infection can present as a red wound accompanied by severe pain, drainage, and a temperature of over 100 degrees Fahrenheit. To prevent infection, keep your wound clean and dry. We will explain how to cover your wound and how to dress it, as well as the foam in and foam out technique. Pneumonia can present with a fever, cough, and shortness of breath, and usually appears after you have left the Joint Replacement Institute. Use the equipment you have received to exercise your lungs and keep mucus out. Hip dislocations can present as pain in the hip, immobility, and a noticeably shorter operative leg, indicating the hip socket has come out. To prevent this, follow the hip precautions we reviewed for 3 months. Your doctor will release you from these precautions when you are ready. Pulmonary embolism can present as sudden chest pain, difficulty or rapid breathing, shortness of breath, sweating, and confusion. It is rare. If you do experience symptoms, call 911 immediately. Your guidebook goes into detail about possible complications and how to prevent them. Ankle pumps, post-operation exercises, walking, and blood thinners will help prevent most complications. Remember to reposition yourself frequently and to walk as much as you can. You will meet with your doctor 10 to 14 days after your surgery to remove staples and discuss your return to driving. The St. Mary's Joint Replacement Institute will call to check up on you and see if you have any questions. Every 2 months, you will receive a postcard inviting you to a reunion lunch. This gives you a chance to share how you are doing, as well as any suggestions you have on how St. Mary's can improve the Joint Replacement Institute. You have choices when it comes to your post-op care. Always check with your health insurance provider to see what they will cover. Medicare covers skilled nursing, home health, and outpatient services. You will need your own transportation, but these services will assist you in and out of your car at the facility. You can acquire skilled nursing services at a nursing home. Patients usually stay about a week. For home health services, you must be homebound and only leave for doctor's appointments. Otherwise, Medicare will stop paying. If you choose outpatient services, there are several outpatient clinics in the area. Ask the Joint Institute staff for locations and contact information. Use your guidebook as a resource for information. Please read it carefully. Fill in the medication sections and plan accordingly. Congratulations on your joint replacement and your journey to a better life.